Assalamu alaikum. Good morning. Bismillahirrahmanirrahim. This is a public service effort that we are making on behalf of Arthritis Care Foundation with the collaboration of Getz Pharma, and we are extremely thankful to them for facilitating us. This is also part of the educational goal of every institution and organization that I am affiliated with. This is a follow-up to the first webinar that was given by Professor Nikat Mir Ahmed. So I'm not going to cover a lot of things that she already has. I would like to dedicate this to Dr. Osama Riaz. He lost his life on behalf of us, and I think it is our duty to ensure that we do not lose any healthcare worker to this disease, as well as save as many patients as possible. So in addition to Osama, I dedicate this to all the doctors, nurses, and patients who are affected by this disease. My primary target audience is the general physician, but I'm hoping that the general public will also get this message. I'm going to be dividing this into three main divisions, which is one, talking about COVID in children, that is 16 years and less in general, and then COVID in children with rheumatic diseases, and addressing some of the frequently asked questions that have been put to us. What is COVID-19 and why has it brought the world to its knees literally? It's basically a virus which initiated from animals, but now humans are vectors. The transmission happens very easily, particularly because this virus can be transmitted even from asymptomatic people. So as opposed to seasonal flu, where generally the patient has a cough or a coryza or a stuffy nose or fever, this COVID virus can be entirely asymptomatic, and up to 80% of patients who are infected with this have no symptoms at all. So you are actually interfacing with people you think are safe from this disease when actually they may be giving it to you. So they are acting as asymptomatic vectors. The other thing is that the spread is exponential. So there is something called an RO of a disease, which means that if one person is infected, how many people does it spread to? So like the flu, if you have one flu patient, it has an RO of 1, which means it will infect one person. With COVID, the RO is 2 to 2.5. So one patient will infect 2 to 2.5 persons, and then they will go on to infect. So you multiply it. So 2 and 2.5 goes to 4 and 5, and then that goes to 10, and so on and so forth. And that is why there has been such a big explosion. The other thing is that the mortality is much higher than that of other common viruses, and it is 10 times that of the seasonal flu. It's especially dangerous for subsets of population. We already know that the elderly, and particularly people who have heart diseases, diabetes, lung diseases, etc. But please remember that children with comorbids, so you have kids who may be diabetic, you may have kids who are asthmatic, they are on medications, maybe on steroids, inhaled or otherwise, and particularly children with rheumatic diseases, they have decreased immunity. And if they are on disease-modifying drugs, that may decrease their immunity as well. Luckily, no mortality has been reported in children, but please remember, children are not immune from it. Number one, and most dangerous, they can be the most lethal asymptomatic carriers who can spread this disease to everybody in the house as well as the community. So how does it transmit? We know that it transmits from droplet, from fomite. It can survive on surfaces, plastic, steel for several days, on cardboards as well, and for a few hours in the air. We now know, and particularly in children, that a fecal-oral transmission may be happening, which means that the child can excrete the virus in the feces. So when they go and pass stool, if they're washing themselves, the virus may be on their hands. If the parent is washing the child, the parent's hands may be infected. So you have to go through the whole regimen of washing your hands or ensuring that your child's hands are washed. Also, virus has been detected in eye secretions. We don't have enough data, generally speaking, but it has been detected. So if your child is a vector or is infected and is crying and the tears carry the virus, so imagine, and you're not aware of it. So it may be transmitted not only to your hands, but to the clothes or to the bed, linen, other things. So one has to be very careful. We spread it with our help, as I said, because the droplets stay in air, they are on surfaces, tears, feces. People, when they sneeze, cough, and into their hands or on clothing without making sure that they've totally covered their face, and then their hands, they touch things or they shake hands, or they using household things while cooking or cleaning or whatever, and this virus is surviving for up to several hours, so that can go from person to person. That is the most common way of spreading, the droplet through sneeze and cough, but the most dangerous is the asymptomatic, where person has no symptoms, they don't sneeze, they don't cough, yet when they talk, the droplets with our talk, or if they are touching their face, as I said, tears, secretions, they have it in their hands, they touch their hair. All of this is a potential source of infection for others. As you can see, and I think this was shown in Nikhat's webinar as well, that when you sneeze and cough, the droplets can go up to 6 feet or 2 meters. So that is the reason why we are saying safe distancing. Make sure that people within the house or household are also seated at a distance. And generally speaking, because we have been doing online consults with our patients, too many times, my patient is sitting with a child or some older individual is sitting with the patient, with a child in their lap. And obviously, nobody is wearing a mask. So you are not only, the message is for parents. It's not just protecting yourself, it is protecting your children as well. They cannot wear a mask. So around them, you have to wear a mask, especially younger kids. And there is some early data to show the average age of infection that came out of Wuhan was about, two different studies, was anything between 7 years, 3 years, and some people think less than 1 year is the biggest dangerous group that can be infected. So think about that you have to protect your children, and of course you have to protect yourself and the older population at home. And all of this, once it goes, it's in the air for a couple of hours, and it is on surfaces for several hours, on cardboards, etc. And you are just sitting, waiting to be infected, unless and until you understand how important it is, safe distancing. And as I said, young people are not immune from the disease, although it is more dangerous in elderly, but it can happen in younger people as well. And those who have comorbids may get serious infection. Touch wood, we haven't had any so far, but the potential is still there. And especially when we talk of children of autoimmune diseases like JI and lupus who are taking immunosuppressive medicines, they are increased. There is an increased tendency or vulnerability on their part to either catch the disease or develop serious symptoms. You cannot take them off the medication, because if the disease flares up, that also increases their risk for infection. So it's, you're sort of caught in a bind. You need to control the disease. So the best thing is make sure that they are not prone to infection. They are following all the instructions that we're giving for adults as well. What are the clinical manifestations? Are they any different in children as they are in adults? They're similar, but the symptoms may be relatively mild, and luckily overall prognosis is good, but we have very little data. We do not have enough data, so we do not know whether, since we haven't been able to pick up that many children with confirmed COVID disease. Let me put it like that. As I said, asymptomatic carriers even more than adults, and if they have underlying conditions, they are more susceptible as well. Some things that are different in adults as doctors, and this is addressing the general physician, there is a marker which is called procalcitonin, and you know that we do it for bacterial infections. And generally, procalcitonin is not elevated in adults. However, it has been found to be higher in children. So in children, we find that there is increased co-infection with other viruses like influenza, etc. So you may have the flu and you may have COVID with it. And in children, there is increased risk of having secondary bacterial infection. So therefore, just if you pick up bacterial infection, it doesn't mean that the child doesn't have an underlying COVID as well. The chest CT findings are similar to adults, and we know what those are: subpleural, peripheral, ground glass opacities. There has been a retrospective study that came out of Wuhan, in which, as I said, they had co-infection with influenza A, B, and 1.6% of these had COVID as well. And the most important thing to remember is we know that fever and cough, and we'll talk a little bit about it, is a common symptom seen in COVID infection. But 40% of cases in these children did not have fever. And here the highest attack rate was in children under 1 year. So please take care of those babies that everybody is carrying around and absolutely oblivious to the fact that you may be infecting your children. So how does one know that one has corona? We all know. You worry if you have fever, you worry if you have dry cough, you have low-grade fever. High grade, it's usually not high grade, and your general body aches and pains. And we know that once somebody develops difficulty in breathing, which we call dyspnea, that is something that even globally, because you see the problem is testing for COVID, we do not have enough kits, it's expensive. So generally most people, like the NHS, I know, has given this guideline that, you sort of self-quarantine yourself if you have any of this, but if you have breathing difficulty, that is when you should call the hospital and, you get into queue to get the COVID tested. So breathing difficulty is a marker for serious disease and must not be ignored. So is there any drug for treatment? The answer is no. No proven direct therapy is known. Basically, you support your patients. Number one, of course, quarantine. If they're hospitalized, you quarantine them in the hospital, but generally more and more people are shifting from mild to moderate to have, isolation done at home. If they're in the hospital, mostly it is supportive treatment with fluids, etc. A drug which is a buzzword now, hydroxychloroquine, it is used in our autoimmune diseases, particularly patients with lupus. And our patients can't get it because packs of them have been picked up from the market. I have had tweets and I've had social media alerts which are saying, so and so. And I know for a fact that this has been done. This has been handed around to doctors in certain places, or even within family members that take it as a preventive, like you take an anti-malarial drug. There is no data to prove that it prevents the disease. Yes, there is data to show that if you have the infection, it may help in treatment. However, please do not self-treat. And particularly, nothing is safe without having an expert who knows how to treat these diseases. Certain antivirals and anti-IL-6 have been used. IVIG has been used as a tier 4. There have been some data coming out of intensive care units in the US, where they have shown that once the disease enters into the pneumonia and cytokine storm area, then maybe corticosteroids at that point may be helpful, but this is something that should be done by a specialist who knows what they are doing, by an ID specialist in an intensive care unit. So corticosteroids generally are not recommended as treatment unless and until you land up with a cytokine storm in a very, very critical care setting. So the key is prevention. How do you do that? We talked about social distancing, number one. Number two, washing hands for at least 20 seconds frequently. And washing hands means everything. So you clean your palms inside, and I think there are very, very good videos available as well, on top of your palm, the base of your fingers, the tips of your finger, around your thumb, around your wrist, and you make sure that you do it for 20 seconds as well. Please try not to touch your eyes and your nose and your mouth. And if you cough or sneeze, you should be doing it directly into a cloth like your sleeve. If it's a tissue, kindly discard. Immediately wash your hands as well. And all surfaces that you touch must be disinfected daily. There is, again, Lysol is not available. You can make a disinfectant yourself, gallon of water, 1/3 bleach water or Dettol, and you just put it in a spray bottle. Everybody knows how to do that. Thing is, you must do it, and you must do it regularly. One thing which is very important for kids, as well as the rest of the family members, but particularly children, is that they have a tendency to open the refrigerator and, whatever their hands, however high the shelves that they can reach, they just take out whatever packed stuff is there. This virus can live up to 28 days if it is refrigerated. 28 days, which means right now, all of you need to open your fridge, take out everything, wipe all the surfaces, wipe all the cartons, bottles, everything. And whatever comes in from the shop. There should be one dedicated person who goes, who knows that he has to change his shoes. You should have a if nothing else, you can have an overall, a wrap. Women can wear an abaya, cover their head. They should be masked. You can wear gloves. So everything is discarded outside, and then you come inside, and everything that you're bringing, if you can put it in a handbag or a bag that is clean, taken from the house. Otherwise, if it is a shopping bag, that needs to be emptied. Every carton out in the sun should be sprayed, let it dry, and then it needs to come in. I cannot emphasize enough how important it is for the health of you, your family, and your kids to do that. Then we talk of social distancing. How are you going to socially distance yourself from a little baby? Almost impossible. You cannot put a mask on very little kids, so you have to mask yourself. And I think in this case, since we know that up to 85% of kids and 80% of adults can be asymptomatic carriers, it's safe to say in a situation where either of the one cannot be masked, you should be having an N95 mask. So for children who are being taken care of by mothers must make sure that, if the child has the virus, they don't get it and they don't give it to the baby as well. Stay away, 2 feet away. If it's a family group, everybody needs to stay away and you should be masked. Definitely don't shake hands. Try not to hug. Avoid social gatherings. These days we are trying to walk, and you walk, separately. And I have come across this family, I think 4 days in a running. I think they are domestic workers in a household. So in the evening, this husband is teaching his wife how to ride a bicycle, which is really nice to see. But the only thing is, just look at the proximity. The husband, the wife, he's holding the bicycle. She's sitting on the bicycle. 2 excited children are clustered around. None of them is wearing a mask. So you need to sit with your domestic help or your workers at home. There are very good videos in Urdu as well. You will find a lot of links on Arthritis Care Foundation website. All of this material is also available. There is a very good brochure by Dr. Naveed of PKLI in Urdu as well. There's a home care guide that has been developed by Dr. Saira Elaine, which is fantastic. And some of us at AC Arthritis Care Foundation have worked on a booklet as well. All of this is available on Arthritis Care Foundation website. So please go there. Ensure, if you are not educating your health at home, believe me, you are sitting ducks for infection, because they will be going home, they will be interacting, they have no clue, they think it's a joke. And again, Allah Malik hai, हमारा ईमान. लेकिन वो एक हदीस है कि आप अपने ऊंट को बांधें और फिर दुआ करें. So Allah Ta'ala ne, I think He has put, God has, we are responsible for ensuring safety of people around us. And then you pray, but you have to try your best. As health givers and as family members, please ensure that this message gets through. If somebody has, and this is, I could not find one with a baby or a young child, so this shows an elderly person, but basically if this is a child as well, or it's a baby as well, you're feeding them or you're taking care of them, please see that whoever is dealing is wearing a mask. It's good to have washed the utensils separately from everybody else once they are used. Wash your hands after that. The bathroom hand doors should be cleaned every time. The handle of your door must be cleaned. And as soon, if somebody has any problem, as I said, shortness of breath is a red flag. And if that happens, you have to immediately, get in touch with the healthcare personnel. And this is something that is, this is a wonderful graphic again that work has been done by, as I mentioned, one of our arthritis care members, Dr. Saira Elaine, who's assistant professor as well. And here it is shown. See, this is a room. And I don't have a pointer, but number one is a window. So wherever you have a suspected person that you have isolated or quarantined, it must be an airy room. There must be a window. At all costs, it should not be a closed room. You need to give them a separate bathroom. The bathroom must have some ventilation as well. And you have a side table, and you have a table outside where you have the mask and the glove and the gowns and everything, so that whoever is going to be entering this is going to ensure that everything is taken on. So you put on your glove, you put on your mask, your cap, your gown, your shoe cover, you go in, you attend, then everything is to be taken off. Once you leave the room, the black little box next to the number 4, which is right at the end of it, is actually the waste where everything needs to be discarded. So I think some of the questions that people have been asking us, one I have already addressed, is that how different is it from influenza and other viruses? Most viruses are symptomatic. And other than COVID, which is asymptomatic and it can be spread. Can you have co-infection? Yes, you may have other viruses, you may have bacterial infection, and you may have COVID as well. What is the role of hydroxychloroquine prophylaxis? We do not know, there's no proof, and we do not recommend. It is in fact probably a little, irresponsible to use HCQ for prophylaxis because then not enough is available for treatment. There's also been a lot of, again, buzz about using hydroxychloroquine plus azithromycin for treatment, because there was a study that showed that there seemed to be improvement in those patients who were given both together. But once it was sub-analyzed, it was seen that the subgroup that had azithro actually had a lower viral load. Number 2, both these drugs can prolong the QT interval. So if you have an underlying morbidity, cardiac issue, whatever, then you are actually increasing the risk for a cardiac event. Many people have been asking, how do we increase immunity? Immunity in children, particularly I'm talking about, but I think this applies to adults as well. They must get adequate sleep. So 8 hours minimum, 8 to 10 hours, because that improves your immunity. They should take lots of vitamin C, zinc, so fresh fruit, citrus is a good source, protein in the diet. Avoid fast food, avoid chips, etc. All these prepared, marketed, boxed, canned foods have additives that you do not realize are actually decreasing your immunity. So please keep your kids away from them. What is the message generally for patients and children and parents with autoimmune diseases? So some of you, if children are old enough who have juvenile arthritis or have juvenile lupus, or younger kids with parents who are listening, or all of you physicians out there who may be dealing with them, please remember that the immunity in this subgroup is low. We don't know how low, we do not have the data, we do not know if it is as low as a subgroup of those who are 60 years and above, but we know that it is low. So you need to self-isolate. Either children need to be isolated from old elderly people. Older children can self-isolate, younger ones. So younger kids, parents, family should treat themselves as having COVID virus when dealing with those children. So you make sure you don't give it to them. Plus, treat those children as having COVID virus so that those who you cannot put a mask on, etc. To make sure that you are taking all precautions so that they, if they are infected, they don't give it to you. If you are infected, you do not give it to them. Please stay at home, you know that. And if any person has any infection, please stay away from them. If you're fine, then continue your medications. And when I talk of medications, I'm talking hydroxychloroquine, methotrexate, leflunomide, which is available in various forms, Lefora, Rulef, Cara, um, hydroxychloroquine, available as HCQ, and some other names like oxychlor, plaquenage. Of course, you'll continue. You'll also continue Imuran. If you are getting any biologic like Enbrel, etanercept, Momentum, Cosintex, Actembra, uh, you whatever you can take at home, you will continue. If there are any IV infusions, and we know that there are biologics that are given as IV infusions, or there are DMRs like cyclophosphamide for which you have to go to the hospital. Message is that we are trying to keep people out of hospitals at the moment. So unless it's absolutely necessary, maybe for the time being, they can be switched to something oral. Those biologics which are available as subcutaneous injections can be continued. If you have an infection, if you have any infection in the house, these kids need to be kept away. If the child has an infection, only then these medications should be stopped. However, you do not stop them from taking their hydroxychloroquine. And if they are at any dose of delta-cortyl, prednisolone, please continue that. For pain, you only give paracetamol, Panadol, Calpol. There has been data to show, particularly with ibuprofen use, because children use ibuprofen more than anything else, that it seems to upregulate receptors that are used by the COVID virus to enter the cells. So that is why, the message is do not use ibuprofen and avoid other non-steroidal anti-inflammatories as well. Other than this, if you have any problems, we have helplines that are available, and that will be given at the end of the talk. Arthritis Care Foundation has helplines. You can call if you have any questions. All of us, for our patients, if there are any out there, we are all available through the receptionists who generally give you the appointments. All those patients who come to our community service clinics of Arthritis Care Foundation. We have helplines for them as well, so kindly use them and stay safe, basically. This is the same repetition again. Here is the helpline. It is available. You can, this webinar will have recording as well, and you can go to it at the end of this presentation. I think it's going to be available for a while, and the link will be out there for you to address. And I would like to...
Can we take questions?
Yeah, sure. So if there are any questions, I'm open to questions now.
One question was that the medication, there are certain medications that affect suppress the immune system. So what are your recommendations on that?
Medications that are used for serious diseases like SLE, dermatomyositis, connective tissue diseases, Sjogren's, even in adults and in children as well, juvenile arthritis. The thing is that these autoimmune diseases decrease your immunity as well. If your disease is going to be active, you are at increased risk for infection. So I've just mentioned, if your disease is controlled, do not stop your medication. If you get an infection, any infection, fever, anything, it doesn't have to be COVID, any infection, then we always counsel stop all medications except hydroxychloroquine if you're on it. And if you're on any dose of delta cortical or the steroid, you will continue it as is, and you'll just take Panadol or paracetamol or Calpol for pain or fever.
Okay, ma'am. What is the reason of less severity, mild symptoms in children?
That's a good question. We still don't know actually. Why is that? There is one, because theoretically we know that children have immunity that is developing. And so up to the age of 5, 7 years. And so one would have thought that, younger children should be, as I said, in the same increased age group as our elderly. But the data doesn't seem to show. Although they're not immune from it. One theory is that children, when they are growing, are exposed to a lot of viruses. And some of them are coronaviruses, not necessarily COVID-19, but other coronaviruses. And so maybe they have developed partial immunity to it. But that's a conjecture. I mean, we don't know for sure.
All right. Do you recommend serial chest X-ray for assessment about prognosis of COVID-19 infection?
If you have a patient who has a COVID-19 suspected infection, they should be immediately isolated, quarantined with all the precautions that I have just said. And the quarantine for the patient and contacts is minimum of 14 days. Generally, you monitor their fever, their cough. If they develop shortness of breath, you must get a chest X-ray. And if it is suspicious, sometimes chest X-rays, do not show up anything. They should have an HRCT done. You monitor with things like pulse oximeter, because if you see a dropping oxygen level, you should do their LDH, you do their ferritin, because they may be rising, D-dimers may rise. A very important thing is CBC, in which we see that these patients can have a low TLC, particularly low lymphocyte count. They may have low platelets, which is a bad prognostic factor. Procalcitonin is high in kids, especially, but in adults, it may not be high. They may have increased ferritin, I think I already mentioned. So, serial chest X-rays, no. I think X-ray to start with, yes, and a pulse oxy, and if there's hypoxia or anything, or dyspnea, even if the X-ray is normal, you should have a baseline HRCT chest.
Right, ma'am. If a child is taking immunosuppressive medication, should we stop or change the dose?
No, as I said, if the patient, if the child is stable, and if it is a disease, all right, let me say, if they are on hydroxychloroquine, you do nothing. If they are on methotrexate or on Imuran or leflunomide also, don't decrease anything. If they are on IV endoxin, then we, as we said, because you may need to take them into the hospital. Some of our patients who need the endoxin because they have lupus nephritis or they have vasculitis and they need this drug, some of us are switching them to oral endoxin for the time being. So if it is an infusion, or if it's a biologic that needs an infusion like Remsima or infliximab, or when Actemra was given as infusions, we are discouraging that. We probably, yes, you can continue the subcutaneous treatment. Don't stop the medication, because if the disease flares up, that also decreases their immunity and increases their risk for infection.
Patients that are taking glucocorticoids for long term, do this patient needs to take doctor's advice in this situation?
If they are taking glucocorticoids, and that would be the delta cortical or prednisolone, ideally we try and have maintenance delta cortical 5 milligram or less, unless there are some situations where, say, before the corona outbreak, somebody came in with an acute serious manifestation of lupus nephritis or dermatomyositis, and you had to, or some other diseases, you had to give them a high dose and they were on tapering. This will increase the risk for getting the COVID infection. But if they are on doses of delta cortical and it was used to suppress their disease, underlying disease, it's a catch-22. What do you do? I think the best thing would be that you should have them contact their treating physician, their rheumatologist, and immunosuppressives like the DMRs that we talked about are safer than a high dose delta cortical. That is for sure. But if they are on it for a long time, they cannot stop it. In fact, sometimes if you have an infection, because you do know that all of us produce equivalent of 7.5 milligram of prednisolone in our bodies every day. That is normal. So when we give endogenous delta cortical, that production is suppressed. And when that is suppressed and your body is under attack, you can actually collapse. So because your hypothalamic pituitary axis is depressed. So the thing is that no, you will have to continue with as minimum a maintenance dose as possible. Don't stop it, but ask them to contact the rheumatologist.
Okay, ma'am.
There's no hard and fast, but generally, yes, don't stop it, and definitely don't go below 5 milligram of prednisolone.
Ma'am, what do really increase immunity level of immunity level, vitamin D3 or vitamin C? What do you recommend?
Generally, D3, there have been studies to show that yes, it does improve immunity. And in autoimmune diseases, connective tissue diseases like lupus and all. So yes, vitamin D3 should be optimal. I didn't mention it. So yes, but you do not want to over medicate vitamin D as well. Remember, you can cause hypercalcemia. So you give a reasonable dose. But vitamin C and zinc is being recommended at the moment to be given to children and adults to prevent the corona. And of course, as I said, adequate sleep and make sure they eat well and stay away from fast food, etc.
All right, ma'am. We're done with the questions. If you have any last remarks, you can close.
I think most important thing is that our belief is our strength. Our belief in Allah, in God, in the Almighty is our strength as a nation. And globally, I think more and more people find that faith in God gives them strength. But in this world, He has given us a responsibility to be sensible, not to be foolish, not to be stupid, not to be irresponsible with our health and the health of our families, of our children, and our doctors. Please understand that. And so, since there is no treatment as yet available, we know that the best way to beat this is to prevent the infection. So, when we trust in Allah, but we have to do what we have to do. You tie your camel and then you pray. So, all of these guidelines, this is what has happened, how people have fought this and they have come out of it. But unless we address this issue, unless we educate ourselves, and most importantly, I think 90% of our population is still in the rural areas. And I know the illiteracy rate we don't have any, unfortunately, we have no data. So you need to sit down with everybody around you. If you have a driver at home, your cook, the girl who comes in to wash, clean, do you know that they go home? They have one room quarters, everybody's sleeping next to each other. The least that they can do is wear masks, wash their hands. They have to try and protect each other. And when they come to your place, you ensure that they have followed all the safety measures that we have just talked about. I think that is the message. It is, may, God, Allah be with all of us, with you, but we need to be very sensible. We must try our best. One word about people who are doing a lot of, sort of like community service work, and please ensure the quality of the products you're putting out in the market, whether they are personal protective gears or masks, etc. And when you're disseminating rations, please ensure social distancing. I think that is my message. I want to end with this a really beautiful prayer that that somebody had shared with me that Allah, God, you have given, you have shown us your power and your strength, and now please show us your mercy and forgiveness. So may He be kind and merciful to all of us, and keep us all safe and our children as well. Thank you so much. Khuda Hafiz.